The next study that I critically appraised was written by Wesselink et al. It was a prospective cohort study, and the purpose of it was to assess the association between habitual dietary intake of magnesium, calcium, and prevalence of severity of chronic chemotherapy-induced peripheral neuropathy in colorectal cancer patients receiving adjuvant chemo. They used newly diagnosed colorectal cancer patients and recruited them directly after diagnosis in 12 hospitals in the Netherlands and were followed up during and after treatment. The sample included 196 colorectal cancer patients with men and women of all ages who were in any stage of the disease. The setting was chronic chemotherapy-induced peripheral neuropathy was assessed 12 months after diagnosis using the Quality of Life Questionnaire CIPN-20. The independent variable was magnesium and calcium. The dependent variable was chronic chemotherapy-induced peripheral neuropathy. The measurement they used was a food frequency questionnaire, and prevalence ratios were calculated using the association between magnesium-calcium intake and the prevalence of chemotherapy-induced peripheral neuropathy. Multivariable linear regression analysis was used to assess the association between magnesium-calcium intake and the severity of chemotherapy-induced peripheral neuropathy. The findings were that there is an association between higher dietary magnesium intake and lower prevalence and severity of chemotherapy-induced peripheral neuropathy in colorectal cancer patients. The tool I used was the JBI checklist to critically appraise it. The strengths were that this is the first prospective cohort study which assessed the association between habitual dietary intake of magnesium or calcium and chemotherapy-induced peripheral neuropathy. The limitations were that there were detailed data on dosage, frequency, and compliance was lacking, and supplement use was not consistent over the study duration. It had very low risk and it was very feasible in practice. The level of evidence was 3, low quality, so I decided to exclude this study.